This is an overview of IV insertion and management. This is not a detailed slides, but this gives you an overall point of view on how to insert an IV and what is the management of maintaining an IV. The purpose of this presentation is to educate the healthcare team, which is the licensed practitioners, on IV insertion and management. The policy related to IV insertion and management is given below, and this is again a summary of the policy. So the PIV catheters are changed or replaced when clinically indicated. This is as per the CDC guidelines. The peripherally inserted IV site assessment and monitoring is done every 2 hours or more frequently based on the prescribed therapy. For example, for blood transfusions, you may have to assess and monitor the site more often than 2 hours, and same goes with the chemotherapeutic drugs. The PIV inserted at another location, which means the patient is coming from outside, and if it is inserted by another facility, healthcare workers or the EMTs, you can keep it if there are no complications noted at the insertion site and the equipment used are according to your institution's policy. Now, most often, RNs are allowed to insert IVs only on the upper extremities. The lower extremity insertion, in very, very rare circumstances, only be done by a licensed provider, such as a physician, a nurse practitioner, or a PA. Another part of the policy states that about the flushing or maintaining the patency. Usually, the flushing solution is 0.9% normal saline, and we use a pre-filled 5 ml syringe for flushing. And flushing is done every 12 hours if the PIV is utilized intermittently. And the line should be flushed after every time you access it or use it. And always use needleless device caps, and when you access it, those device caps should be cleaned with alcohol, which is also known as scrub the hub. The site selection, as I mentioned before, only the upper extremity sites are accessed by an RN, and you always look for the best sites on both arms for the best vessel. The most commonly used peripheral veins are listed here. Another important factor we have to keep in mind before starting an IV insertion is any restrictions, limb restrictions for that particular patient. And usually such patients will have an alert band placed on the hand, but you also may have to ask the patients whether any limb restrictions are there for the particular limb, such as history of mastectomy on that side or presence of a shunt or a fistula for dialysis patients, and any recent dissection of or biopsy of axillary lymph nodes. The surgical procedures or circulatory problem for a venipuncture specifically for that particular limb you are looking also should be monitored. So here are the procedure steps which you all are familiar with. Just want to re-emphasize the patient identification. Always use or perform the patient identification process using the 8 rights, which is written below. You can go through this list for inpatient versus outpatient patients and the emergency department. Slightly different between the inpatient and emergency department patient identification. However, most of the key elements are there, which are the 8 rights given in the middle. You always have to reinforce the patients and their families about the maintenance of IV that is inserted, and reporting any unusual um, side effects or complications, and activity restrictions. And we always use teach back methodology to inform and educate patients and families. The policy about the IV tubing is listed below. Basically, all type of non-medicated continuous infusions, just like Ringer's lactate or normoxidine or 5% dextrose, all could be used for 96 hours or 4 days. Whereas intermittently used IV fluids with medications, you have to change the tubes once in 24 hours. And all TPN and lipid tubings are changed every 24 hours. And blood product tubings is changed after the administration of that particular unit. If we are using any lipid-based medication, then those tubes should be changed every 12 hours. The IV fluid bag is changed every 24 hours, or as it is indicated by pharmacy on their label. Now, one important factor, if you find any tubing that is not capped after use, especially intermittently used IVs, then that tubing is considered as contaminated and need to be discarded right away. Once you finished IV tubing, IV bags, and you are changing the tubes or changing the bags in such occasions, always make sure that you remove the patient identification labels. Either you can use a magic marker to obliterate the identifiable information, or just peel off the identifying label from the bags or the tubes. This is in accordance with the HIPAA protocol. And this is the slides on IV insertion and maintenance. You are supposed to take a post test on this, and the passing score is 100%. All the best.